A beautiful day mga kapitbahay. I'm Contessa, your host here at Certified Skin Authority. Welcome to another episode of CSA. Today we will be talking about basic skincare tips for teenagers. Ano po ba ang tamang pamamaraan ng pangangalaga ng balat ng mga kabataan? Join me as we listen to 3 different teenagers who had their problems in their skin. Let's learn how they had improved their skin condition. So mga kapitbahay, stay tuned lang and watch the show. Welcome back mga ka-CSA. Meron po tayong segment on basic skincare tips. Well, right now po, pag-usapan natin po ang tamang pangangalaga ng skin among teenagers. Joining me are 2 wonderful teenagers. They're actually, I think they're both celebrities right now. And mga kapitbahay, let's welcome Miss Trisha and Mart. Hello!
Hello!
Kamusta ang ating mga naggagandahan at gwapong guest ng CSA?
Ayun, gwapo ka.
Hey, of course, always. So, our kapitbahay would wanna know something or more. Hindi something, more about you. So, start with Trisha. Ladies first. Let's get to know about Trisha.
Hello, my name is Trisha Bernales, 14 years old, turning grade 9 next school year, and a regular Poland Tulagan with the Master Showman.
And
ayan, ako naman pala si Mart Katakutan, 17 years of age, and a regular din sa Walang Tulugan. And a singer.
Eh di mga kapuso pala ang mga batang to. Welcome sa kapitbahay. Okay. Yes, Mart.
Wala na. Siyempre kapuso kami. Try naman namin lumipat sa kapitbahay.
Okay. So, good to have you with us here. So, ang ating mga viewers would want to learn ano ba yung mga proper skincare, especially for the young ones, the teenagers. Ano na nga palang ulit age? Like Trisha is 14! Wow! Ang bata! And Mart?
17.
17! Naku, mga anak ko na, o diba? So, would you want to share with our kapitbahays your routine skincare, how you take good care of your face, especially on a daily basis?
Okay. Ako po, I use Cetaphil 2 to 3 times a day, get enough rest and sleep, tsaka eat healthy.
Oh, that's nice ha, kasi parang sa iyong lifestyle na you're telling us you have adequate rest, tapos you're eating healthy kinds of food, di ba? That's one thing that we should always be doing every day. So, thank you, Trisha. What about Mart here?
And me too, I use Cetaphil 2 to 3 times a day, and gumagamit rin ako ng Sunblock.
Wow.
And syempre kumakain ng vegetables, fruits, syempre Doc. Turo ni Doc yun. And natutulog ng at least 8 hours.
Okay, parang lahat ng mga sinasabi ko sa inyo, pinapollow ninyo, no? They've been with us also here at CSA for quite a while. How long na ba? Like Trisha, how long have you been with CSA?
It's only been like 5 months.
Wow. And of course, Trisha has maintained her beautiful skin. I think you have, yung sa mga, what do you call this, ang race mo, hindi ka pure Filipina eh. Maputi.
Say.
May lahi bang Chinese or
Malayo na po.
American?
Castilla po.
Spanish. Okay. Si Mart, may lahi din?
Wala.
Okay. So, pure
Pinoy.
Filipino.
Yes.
Okay.
Pinoy.
Kasi I can see na pareho nga kayong maputi eh. Diba? So, since you are mga young ones natin, ito yung ating mga, pag-asa ng ating kinabukasan, ang youth, diba? What makes you busy right now? Kasi you still go to school, right? And aside from schooling, summertime right now. So, what keeps you busy?
Syempre po, nagpre-prepare na po medyo po nag-workshop na po ngayon.
Workshops.
And of course, yung mga taping po.
Tapings.
Motion.
Pero you're still able to manage having the adequate amounts of rest and sleep. Oh, that's good. Mark,
Yan.
What keeps you
Nagtitaping
busy?
rin. Nagmamall show. Siyempre, busy rin sa single ko daw.
oh, imagine ito, mga teenagers, they have their careers already. They're beginning at an early age, di ba? Making use of your time, something that will further develop you, may personality development. It boosts your confidence, your self-esteem. And of course, to add to that, kailangan yung looks ninyo, di ba, ma-maintain. Kasi you're both, maganda na yung mga skin. Di ba? Alagang-alaga. I remember Mart talaga. I have taken good care of Mart. For how long, Mart?
Siguro may 1 year, mag-1 year.
Okay. Pero look at Mart right
Yes.
now. The first time really I saw you, kasi ang teenager problem, common, very common problem among teenagers, pimple, di ba? Kasi Mart, I remember I saw you, you have your acne, mga cystic acne. Pero kapitbahay, tingnan nyo naman po si Mart ngayon. Clear ang skin, free of pimples, di ba? Pati na rin yung mga marks, pimple blemishes, or acne scars. Clear na rin po ang kanyang skin. We have taken good care of Mart. We have made use of CSA treatments. Yung final treatment was the fractional CO2 laser. Diba? So, at this segment, we're sharing with kapitbahays yung proper skincare para isa-isang teenager. And you've been mentioning Cetaphil cleanser. Well, ideally, we should wash. Sinama ko sarili ko. Feeling teenager na rin. Okay, I'm in my 40s. Okay? So, we make you stink. Trisha, I love you. Okay. So, they always mention gentle cleanser. Example, Cetaphil cleanser. So, to wash the skin, we can wash gently with Cetaphil or any gentle cleanser. And of course, here at CSA, we take good care of your skin. At first, we have to do skin analysis. Kasi nung skin is, we kind of have differences. So, pwedeng ako oily skin, pwedeng si Trisha dry skin, pwedeng si Mart oily skin din. Pero right now, normal skin, di ba? So, it will depend dun sa type of skin ng isang tao. So, it's much better to identify your skin condition first. So, yun po. Ano bang type? Oily skin, dry skin, sensitive skin. Ano ba bang alam ninyo mga anak? Yun pala. Meron tayong normal skin, combination skin. Yung combination, meron yung dry areas, may oily areas, merong irritated skin, sensitized skin, yun yung mga sensitive skin. So, we can name a lot of types, depende kung ano na yung stage ng skin condition. So, it's much better to learn to make sure na, kasi before you apply anything, alam mo muna kung anong kailangan ng skin, anong condition ng skin mo. Okay? Well, we've been teaching you the skincare, basic skincare steps. Di ba? We start with the cleansing. Tapos, after that, pwede rin we use a toner. Ito yung mga solutions that will further cleanse your skin, wipe away yung mga deep-seated dirts, and a toner can balance the pH of the skin. Ayan na naman tayo, Mart. Mayroon na namang pH, di ba? Kasi parang ang pH, di ba, yun yung acidity ng skin. Okay? But of course, for some people, especially teenager skin, for some, you may not use toner na. You may not need it. Okay? So, depende pa rin. Pero there are some toners na gentle naman. Na they only has ingredients na mild lang. Okay? So, pag oily skin, mas maganda you use a toner. Okay? Now, another or third step, yung tinatawag na yung moisturizers, ito yung may day cream, night cream, di ba? So, depende sa need ng skin. Kung ang skin mo oily na, not much of the moisturizing cream. Okay? Pero kung dry or sensitive, you may use the moisturizer. And then, you mentioned sunblock. It is important to apply sunblock. Okay? So, usually those are 4 steps. Basic skincare steps. Cleansing, toning, moisturizing if you need it, and then the sunblock. Okay? But of course, our televiewers, our kapitbahays, it is much better to visit us for you to know what is the type of your skin. Kung ang skin mo ba dry skin, oily skin, acne-prone skin, sensitive skin, etc. So you can know what type of products you should be using. Ito rin po for your own safety na rin. At ma-prevent natin yung mga irritations or any problem on our face, on our skin. So aking mga anak, do you have any questions?
Opo. Is it still necessary po na mag-apply po ng sunblock or sunscreen kahit po di lumalabas ng bahay?
That's a very good question, Trisha. We advise our clients, especially during summer, to really put on sunblock every day. It is a must to apply sunblock during daytime, even if you are indoors or in the offices, in the school. These are UV protection, broad spectrum protection. Kasi inside the offices, like here right now, we have UV rays from the UV lamps. So, put a shield, put a protectant on your skin. Okay? Thank you for that question, Trisha. Mark?
Doc, meron din akong question. Kapag may pimple ka, safe po bang lagyan ng kalamansi?
Wow, that's another good question. Some people make use of a home remedy daw. They directly put on the calamansi. Kasi the pimple is already an inflammation. And when you put a calamansi, it may further irritate the pimple. Baka nga ma-infect pa kasi hindi naman sterile, di ba? So, I don't recommend it. So, much better to see na lang, seek help from your doctor, from a skincare specialist, di ba? Kasi it might further irritate the skin. Well, sa mga uses of mga calamansi, idagdag natin some ask about garlic daw, or even tomato, okay? Well, wala kasing scientific study that will prove their efficacy or their safety. However, they were used because they are composed of some antibacterial components. Meron silang parang antiseptic. Kasi ang pimple aggravated by infection also. But then, of course, do not put calamansi. Kasi baka ma-worsen yung pimple. Thank you, Mart, for bringing that up to me.
Ako, Doc, may isa pa pong tanong. Same number of times pa rin ba po nag-a-apply ng cleansing po yung mga may dry skin, oily skin, tsaka sensitive skin? Doon po sa may healthy skin.
Ideally, we recommend to wash your face with a gentle cleanser twice a day. One in the morning, one in the evening. However, for some people na sobrang dry or sobrang irritated or sensitive ang skin, in the morning, they may opt not to. Just water na lang. Okay? In acne-prone skin, they may wash 2 times to 3 times a day. Gently, and do not be very forceful or parang so harsh. Parang ini-scrub mo lagi yung face mo. So, it's just a gentle stroke in washing the face. So again, kung very dry, very irritated, or very sensitive skin, at bedtime, bago matulog, wash na yung skin with a gentle cleanser. Yung mga liquid cleanser preferably, not the bar soaps, okay? Kasi parang may rough areas din yon. So pag morning time, just with pure water. So again, maganda yan, you consult. So you know what is safe for you. Mark, any more questions?
So yun, since na sensitive po yung skin mo, parang sinabi niyo na rin po na hindi safe na gumamit ng matatapang na soap.
Yes.
Like mga whitening soap,
Yes.
soap.
Yung mga may irritant dermatitis, allergic dermatitis, seborrheic dermatitis, etc. Those are kinds of skin conditions also that we see here. We just advise them not to use any harsh cleansers, harsh soaps. Mayroon tayong mga mild, super mild cleansers lang. Ito yung mga tinatawag namin soapless soap. Wala silang bula, di ba? Two kinds of soap, soapless soap, and a soap. Di ba?
Walang na.
Yeah. So we're learning tayo. Itong mga ating mga teenagers are further being informed and helping our kapitbahay, of course. Any more questions?
Last
Tisha?
question po. Yung ano po, tayong mga teenager na po, di ba po?
Sama ko. Sabi ko na sa'yo, Martin, tayong mga teenagers.
Sa mga teenagers po, do you have any other tips po to recommend them, especially po nga sa may oily skin and dry skin, lalo na po dun sa mga di nakaka-afford po para makabuy ng products po na that could give us healthy skin? Ano po yung mare-recommend ko po?
Okay. So yung mga acne-prone skin, oily skin, okay, we have here at CSA, start with the soap, the cleanser. Meron na siyang component na anti-acne. I like the natural ones. Meron tayong mga tea tree soap. These are affordable cleansers naman that they can make use of. Ngayon, I prefer na they will see me and I could recommend kung ano yung mga topical medicines that will be given to them. So, syempre, kailangan yung pasok sa budget ng ating mga teenagers, di ba? There are already topical ointments na ano naman, kayang-kaya natin sa budget. Kasi pag infected yung pimple, kailangan may antibiotic ointment pa rin yun, di ba? And then, start with a very good cleanser. Yung tea tree soap is effective and depende rin. It may depend on the type of problem or degree ng acne ng patient, ng isang teenager. Kasi merong mild, merong moderate, may severe, may very severe. So, doon sa mga mild na puro blackheads, whiteheads, start with a very good cleanser lang. No? Tapos kung yung mga severe kasi tinitreat na natin yan eh. We manage them in the clinic. Pero it is very important to get them treated. Kasi ayaw nating magkaroon ng mga acne scars. So, we can help them. Here at CSA naman po, we are more than willing to solve those concerns po, especially sa mga young ones. So, our parents, we advise po na seek consult po, especially kung mga severe type of acne. Kung mga mild lang, mga blackhead, whitehead lang po, we can make use of topical na pinapahid lang. Pero for the severe type, do not self-manage po. Baka po mag-worsen ang problem. I think Mark also has a question, no? Yung cause ng pimple? Yung what triggers pimple?
Yes, what triggers pimple?
Yeah, kasi kanina you were asking me that eh. Well, ang factors that can lead to pimple formation kasi, di ba usually mga teenagers eh, hormonal factors. Siyempre, nasa ano na kayo, puberty stage, nag-change na yung hormonal status ng katawan ng isang teenager. Ayan na yung nagsisecrete na ng maraming oils, may excess oil production na. Well, aside from the hormonal factors, kasi hindi naman natin makontrol yun eh. Meron yung mga modifiable factors, like for example, yung lifestyle ninyo. Always puyat, di ba? Are you always? Hindi naman. You make sure that you have adequate sleep. Tapos yung mga, well, sa food, hindi yun natanong. Like for example, yung mga kinakain daw. Well, high glycemic index food, types of food, high glycemic diet. Ito yung mga sobrang sweets, mga fatty, greasy food, may cause or may trigger acne formation. So, yung mga may patients ako, sabi na pag daw kain ng mga sweets, chocolates, or nuts, mani, yan, parang natitrigger ang pimple. Okay? So, sa lifestyle yon, we can do something about the lifestyle. The constant use of cosmetic products, makeups, kasi di ba nakaklag yung mga pores natin. Kasi kami, we always put on makeups. Those are factors. Ano pa ba? Sa tingin ninyo? So, mention natin food, cosmetic products, yung lack of sleep or stress. Of course, hindi natin ma-change yung mga hormonal factors, di ba? Nandiyan sa system mo yan. Or genetics. kung ang parents, di ba, nag-acne nung kabataan, pwede
So,
rin
pwede.
tayo, mamana natin ng pimple. So, may genetic factors. Meron pa ba kayong naiisip na factors? Like, anong nag-trigger? Like you, Mart, when you started, parang kailan mo napansin?
Anong age ba ako? Mga 14.
14. So, yung ano rin eh, yung pagbibinata, yung
Teenager.
puberty stage talaga, those are the factors. Pero meron din kasi akong patient na 62-year-old nagpimple sa ilong. But that is, medication-induced pimple. So, meron ding mga, yun kasi like for example, yung may mga steroids or androgen steroids, nakaka-cause ng pimple. Or something na pinapahid sa face, cosmetic products nga, or steroid-induced pimple din, di ba? I think pregnancy is also acnegenic, di ba? Pag ang isang babae will get pregnant, parang acnegenic din. Or pimple-causing factor din sa hormones. Anyways, itong ating mga teenagers, we would want to hear from them. They may want to invite us for some of their shows. Okay, Trisha?
Ayan po, syempre, lagi po kayo manood ng Master Showman po, Walang Tulugan, at Channel 7 every Saturday.
And Mart?
And syempre, supportahan po ninyo ang aking single, entitled Dito Ka Lang Sa Aking Tabi, composed by Mr. Rocky Calicdan. At syempre, lagi kayo manood ng Walang Tulugan with the Master Showman every Saturday.
Yay! Thank you, Mart. So, Mart, is there anything you want to say also to our viewers?
Yes. When it comes to my skincare, take it from Contessa.
Okay, thank you. And Trisha also.
If you want a healthy skin, healthy lifestyle, visit CSA Derm Center here at Pure Gold Duu, 2nd floor.
Ayan, mga kapitbahay, maraming salamat po naway may natutunan kayo sa aming basic skincare tips for teenagers. Magbabalik po muli ang CSA. Welcome back mga kapitbahay. Together with me is another young lady. She was with CSA since 2011. She came to our clinic with a concern on pimples. And right now, looking at her, she's so pretty. Her skin is clear of pimples. With me is Miss Jobel, a 15-year-old young lady. So welcome, Miss Jobel.
Thank you
How
for
are
having
you?
me.
Kamusta ka na?
Okay lang po ako.
Okay. So, you are 15 years old right now.
Yes.
And you will be in what year or grade?
About year 4, grade 10.
Grade 10. Wow. So, do you remember when you came to our clinic the first time?
Yes, I remember. The first time I went there was because I had a lot of pimples and graduation time was coming, so
Yeah.
that I had to get rid of them when it was graduation because I have to be pretty.
Yeah. Because during that time, I think the concern was you had a lot of these pimples, these
Yes.
blackheads, whiteheads on the forehead area. And
Mhm.
also some on the cheek areas,
Mhm.
remember?
That's why I needed to get rid of them very quickly because
Mhm.
graduation was coming close.
Yeah. And you still recall when we did some clinic treatments on you, whenever you come to the clinic, we had treatment programs for you?
Yeah, it was pretty nice, but pretty painful at the same time.
Yeah. Because during that time, the pimples were inflamed and we were giving you some anti-inflammatory shots.
Mhm.
So we can immediately make the inflammation go away. But then after that, after those treatment sessions, what did you notice?
It was really working well. I really liked my skin.
Yeah.
Like, I can finally look at myself at the mirror being happy because there's no more pimples.
So how was the graduation during that time?
It was pretty nice. I enjoyed it.
And then after the graduation, you still maintained some treatments with us, remember?
Yes.
Yeah. And I think I gave you some medications
Mhm.
also. You took at home. You were so compliant. I really recall that. You followed all the instructions and everything, together with the help of your parents, of
Yes.
course. Your parents were also supportive in helping you with that treatment. So
Mhm.
be thankful, be grateful to your mom and dad,
Mhm.
right? Would you want to say something to your parents right now?
Thank you, my mom and dad. Because of you, I would have never met Dr. Contessa and I would never have my skin would have never been this clear and this pretty. I would have never felt pretty.
Yeah.
Because if it's without you guys, you always took care of me. You always been with me all
so
these
sweet.
times.
So sweet, Mom and Daddy. But I think I remember the one who referred you to me was your dentist.
Yes, Dr.
Yeah.
Tuliao.
Thank you, Dr. Lawrence. At least we were able to help Jobel here.
Mhm.
And then, right now, I can see Jobel, so pretty. Her skin is already so healthy. So, any maintenance that you're doing right now?
Like, I wash my face. I have to constantly wash my face and put some moisturizer or something like
Yeah.
that.
So, just keep up with the gentle cleansing, and then if you need to moisturize and also put something to prevent already acne breakouts.
Mm-hmm.
Right. So thank you so much, Jobel. We really appreciate your time with us, and I am so glad that we were able to help you. Okay, any kind of parting words for our kapitbahay, especially the teenagers, the young ones who would want to, of course, they may have the same problem that you had before, and you may want to give some words to them or some advice.
First of all, you have to be calm. Don't need to panic if you have a lot of pimples. If you have any friends or anyone who is a doctor, a dermatologist, you can always go to them because they will always help you. They have the right treatment, and you always have to trust them because they would never, they would always be helpful.
Very well said, Jobel. Thank you very much. There you go, mga kapitbahay. Ang isa nating teenager, okay, natulungan po natin. So, kami po dito sa CSA, we are always welcoming a lot of teenagers with the same concern as that of Jobel before. So, kapitbahay, we'll be back after some break. The most common skin problem among teenagers is acne. What is acne? It is actually a chronic inflammatory skin condition whereby there is clogging of the pores. And this clogging will lead into some further inflammation, and some bacteria may cause infection. How do we treat this problem? It will depend on the severity. For mild acne, we only give topical medicines. Or we can recommend some clinic treatment like oxygen peptide infusion anti-acne. We also have the hydrodermabrasion, whereby there is extraction of blackheads and whiteheads. There's deep cleansing, hydration, and oxygenation. For moderate problem of acne, we may already start some oral medications like antibiotics. We still continue with the topical treatment, and we may still add treatment sessions in our clinic. For very severe conditions of acne, we already give oral medications like isotretinoin, which is a vitamin A derivative. So for every condition of acne, it will depend on what kind of treatment we will give to every patient. No two persons or any persons have the same kind of skin condition. That's why it is very important to consult. You visit our clinic, and so that we can be able to help you and recommend you what is the best treatment for your skin problem, particularly acne. So here at CSA, we will be able to help you. We give free skin analysis. We can be able to assist you and at the same time educate you. Take note, education is important for everybody to comply with the treatment. So don't self-medicate, don't just practice anything or experiment on your face so that we can prevent any adverse reactions. There you go mga kapitbahay. Natunghayan po natin ang mga concerns ng ating mga teenagers. Napakahalaga po na ating pangalagaan ng ating mga balat sa simula pa lamang na napapansin na natin na merong mga pimples o anuman pong mga nakikita natin na unusual sa ating skin, like pangangate, redness, or irritations. So ang ating mga parents, mainam po na dalhin natin ang ating mga kabataan sa doktor, sa mga espesyalista sa balat para po maiwasan natin ang anumang mga komplikasyon. Sapagat po, pag meron ng mga acne scars or anumang worsening of condition, baka po irreversible na po ito. And another thing po, whenever you consult, of course, make sure you follow the treatment regimen. Meron pong mga tamang protocols at meron din pong mga schedules for sessions in our clinic. There you go, kapitbahay. We are inviting you to visit our CSA Derm Center. We are located at the Pure Gold Building, 2nd floor, Dauma MacArthur Highway, Mabalacat, Pampanga. Please call us if you have any questions or comments. Our contact numbers are 045-331-117 or text us at 0917-504-4268. So mga kapitbahay, when it comes to your skincare, take it from the Certified Skin Authority. Thank you very much. See you again next week.